Hi, I'm Louise. I'm the presenter of Auti Talk. I thought I would talk about what is autism. I know that people have done some great advocate work over the past few years and beyond, raising the awareness of autism and what it is. And I think it's a great testimony to their work, how many people know about autism, how it's a word that people in the general public they know about, that they talk about it, and you can find programmes and books on the subject. But I still think, particularly as there's a lot more research and work to do in the area, that some people are very confused about what autism is, even if they've actually heard about autism in the past. So let's start with, what is autism? Well, autism is a neurological condition, and it probably developed when the child was in the womb. There are probably multiple autisms, and by what I mean by this is, let's take dementia as an example. So Alzheimer's disease is a type of dementia, but not all dementias are Alzheimer's. Lots of research is being done into autism, and perhaps in time, in the future, we're going to find out that there are different autisms. But essentially, as the fetus is being formed and the brain is being formed, there are neurological differences. Now, we're all neurologically diverse. As much as our looks are different, so is our brain. But with autism, we have a specific set of symptoms that come from the brain being slightly different, with some neurons in a lot in one place and in other parts of the brain having less. So what causes autism? Well, there are three main reasons. The first reason is genetics. A lot of autism can be traced through people's families, and there are specific conditions such as Fragile X syndrome, which gives you autistic symptoms. Then there's environmental. There's been a lot of talk about vaccinations and autism. That has largely been debunked now. There was a feeling that it could have been caused by a vaccination such as the MMR. And the thinking around that is mainly because people would have the injection at a certain time when the symptoms become more prolific, when actually what probably happened was the person already had autism, it's just that the symptoms started to show themselves around the time of the vaccination. But there are environmental factors that may play or have an impact in autism. For example, toxins such as lead poisoning might have an impact in autism. But the main reason for most autisms would be a combination of genetics and environmental factors. So it might be genetics over multiple genes that are triggered by something in the environment that causes a person to have autism. So let's look at the symptoms. There are many symptoms of autism, but they fit under two main categories. They used to call it the triad of impairments, and social and communication was separate, and that was when the diagnostic manual was manual 4. It's now manual 5, and now the diagnostic manual has combined the social and communication difficulties together under one heading because they're very much similar. So we have the social and communication difficulties, and we also have the restricted interests and behaviours. There are a broad amount of symptoms that go through both of these different topics, but just to give you an idea, so social and communication could be not able to know the social rules in a situation that a neurotypical child might automatically know, not being able to read body language, right the way through to being non-verbal and not using language in that sense at all. And then the restricted behaviours and the restricted interests could be a very in-depth knowledge of trains, or it could be repetitive motor movements, repetitive motor things like what we'd call stimming, which is flapping or doing things in a repetitive way. There are huge amounts of symptoms within this area that fit within those categories, but those are the two main categories. And what they often ask you, and this happened to me when looking at my son's diagnosis and my diagnosis, was, is there anyone in your family that reminds you of you or your child? And then you start to think, oh yeah, no, I remember. It was Uncle Jim, wasn't there? He was really into pipes and he liked to collect cogs. And you suddenly remember that there was someone who had maybe repetitive behaviour, or that they had social and communication difficulties. Maybe Uncle Bob didn't want to go out that often, and you start to think, there is something within a family. And quite often this can be a phenotype, which means that it is sort of autistic tendencies within the family, not necessarily that multiple people have autism, or again, they can have that. So you might have heard autism referred to in different ways, and before the new diagnostic manual came out, the DSM-5, there was the DSM-4, and this is how it described the different autisms. We now know them as an autistic spectrum disorder, and they encompass some of these diagnoses. So we start off with Asperger's. And now I can never say Aspergers. Aspergers. I just say it really quickly because I'm not really 100% sure how to say it. It embarrasses me a little bit. So Aspergers. So I have an issue around that. But that's probably what I've got. But when I got diagnosed, I was diagnosed with an autistic spectrum disorder, a level 1, which would formerly known as Asperger's. It sounds like Prince, formerly known as. And then we've got autism itself, which is confusing because you've got Asperger's and autism. Are they the same thing or not? We'll get to that in a second. And then you have an even more confusing diagnosis, PDD-NOS, pervasive developmental disorder not otherwise specified. I mean, as if it isn't a mouthful enough by having pervasive developmental disorder as a diagnosis, but to go, has it been specified? No, I don't think it has been specified. Not otherwise specified, as if anyone can't be bothered to even specify what you have. So I feel sorry for anyone who's been given that diagnosis in the past. And then we have ASD, as I explained, autistic spectrum disorder. I've noticed, going back to Asperger's, that Hans Asperger was the person who highlighted Asperger's, which is why we call it that. I've noticed the same with Alzheimer's and Asperger's. People who invent conditions, illnesses, diseases often have quite an unusual name. I've noticed there are no Smith diseases or Jones disease, and I wonder what Jones disease would be. Would it be that ladies threw their knickers at you? I think it probably would be that, but I'd quite like to be interested to find out what a Jones disease would be. So we have the spectrum itself, as we call it, the autistic spectrum within the disorder. And now, instead of calling things Asperger's or PDD-NOS, we now refer to it as ASD along the spectrum. And the reason that the new manual decided to change the names was because a child or a person would go to a hospital or doctors and get diagnosed with Asperger's at one place, and then somewhere else they might get diagnosed as having high functioning autism, which is another name for Asperger's, but they couldn't really work out the difference between the two. What is the difference between high functioning autism and what is the difference between Asperger's? And even within a person's lifespan, they may have different diagnoses. So they might start off their life with a diagnosis of PDNOS. Again, I find it difficult to say. And then, because many of the symptoms aren't being shown when they're very young, and then as they get older, they then get a diagnosis of autism, because they have the full condition and they have all the symptoms to be diagnosed. And then as time goes on, as they get older, they're able to cope with their autism better, and they have some strategies to work around it, and they're more like they have Asperger's or higher functioning autism. So instead of diagnosing the same person 3 times, it's a lot easier just to say ASD and then the level of support or the level of disability that you have. So level 1 would be a more higher functioning autism, although I find it difficult to use terms like that. Higher function and lower function is a little bit of a complicated thing to be talking about. But when you get to levels 2 and 3, you will require a lot more help, and you will have quite a few problems. You may not be able to live independently, for example. And often they call it autism with an intellectual disability. And again, that is because at level 1 you might be academically bright, you might have problems in some academic areas, but you might have a high IQ, and you might look, for all intents and purposes, that you're coping quite well, maybe in comparison to someone who's at level 2 or 3. But again, it's still a disability at level 1. So there are different levels depending on the sort of help you need. And because it's referred to as a spectrum, quite often I hear people say, well, we're all on the autistic spectrum. And in some ways that is quite a helpful way to describe it, because there are some people who may not meet the diagnostic criteria, like I talked about the phenotype, but do have autistic tendencies. And so that is helpful in some ways, but in other ways it does take away from the disability to say that we're all on the spectrum, because being on the autistic spectrum is a disability and is different from not being on it. So I'll give you an example that I use about depression. To look at depression, You could say, for example, that there is a spectrum with depression. Right at one end is happiness, and then right at the other is clinical depression, severe depression. And you could say to someone, oh, well, we're all on the spectrum of happiness, but of course we're not. And it's not a very nice thing to say to someone who has been diagnosed with depression. It's a very different thing. So we have a sort of spectrum, so that goes from happiness to feeling blue to feeling sad to mild depression, moderate depression, and then severe depression. You wouldn't say to someone who had mild depression, oh, well, at least you don't have severe depression, because that wouldn't be a nice thing to say. And also, someone who's got mild depression is having a really difficult time. They may commit suicide, and they may have a really, really hard time. Just because they don't have severe depression doesn't mean that they're not suffering from a diagnosed clinical condition, which is what they have. So we are all on the spectrum, but to have ASD, you have to have been diagnosed within a certain criteria that would mean that you are struggling with certain areas of your life. So what are these certain areas that you struggle with? Well, it is a processing disorder, autism. And as I mentioned before, sometimes we call it autism with an intellectual disability. And the current thinking is that perhaps it isn't an intellectual disability, but it's just that your autism, your processing disorder, it causes you so many problems that you can then not function at an academic level, or you have a lower IQ because of the difficulties with processing. So that may in time remove the need for putting with intellectual disability. So we look at how the brain processes things, and within someone who has autism, they may have difficulty processing certain things. And one example is sensory inputs. People who are on the autistic spectrum, they may be very sensitive to sound, for example, or bright lights, and not be able to tolerate it. Or they might be almost not sensitive enough that, for example, they don't feel pain right away. So it can be under or oversensitive depending. And that can be a real problem to be able to concentrate and live your life, and things are too bright, things are too loud, or you're not getting the right sensory input. There are other parts of your brain that are affected, including your emotional regulation, and this means that it's very difficult when you can't process emotions very well. You might suddenly become angry or have a tantrum. Lots of children with autism have tantrums, and adults too have tantrums. And then there are other areas of your life, such as executive function and also adaptive function, which is more about how you live your life. Executive function is how you organise yourself. So you could imagine how many difficulties that you could have with your sensory processing, with regulating your emotions, with being organised, with being able to prioritise things, and also adaptive function, how you live your life. But so much of our life is social, so much of our life involves a lot of organisation, particularly when you get into adulthood. So let's think about what it's like to have a conversation with somebody. It's complicated for anybody. And when a child develops neurotypically, when they get to around 4 years old, they have a tremendous amount of skills, natural skills in the social arena. And then, of course, they're not fully formed socially. As time goes on, we all discover that we learn how to interact with others, and relationships get more and more complicated. So it's the same for all of us. When you've got a processing disorder like autism, just think of all the things you have to process in a conversation with somebody. Imagine you're chatting with someone. You have to work out what that person is saying to you, decode their language, work out what they're not saying. Are they being sarcastic? Is their body language saying a certain thing? Are they trying to hint at something? What about the background noise? What if you can't hear what they're saying? Then you've got to think about how you feel about what they're saying, what your opinions are, and then find a gap in the conversation where you get to say, oh, hang on, this is my thought or opinion. And it is a lifelong learning of how to interact with people socially. But for those people who are on the autistic spectrum, they find it so much more difficult. I find it so much more difficult being on the autistic spectrum myself. And you don't quite realise how difficult it is for everybody, but for particularly those who have a processing disorder. So I would like to just briefly mention to you about the human condition. Life is complicated, and relationship with other people are very, very difficult at times. We learn throughout our lives how to adjust, how to adapt with communication, with being with other human beings, and we are very social beings. People who have autism, they want to be social, they want to communicate, but it's so much more difficult for them. And often, as I found in my life, because I was very late to be diagnosed, I have found strategies around it, but it's very, very difficult. And what I want to say is that we are very neurologically diverse. We are different on the inside as we are on the outside. We all have our own traits, our own personality, and the way that our brain works is different. It just shows in the way that we learn. Some people learn visually, some people learn better when they hear things or when they can touch and be practical, all the different tastes and desires that we have, you know, it's all part of our brain and the way we are. So I'm hoping that I've managed to clarify autism to you a little bit more. It's certainly a journey for me as I try and find out how I fit, how the person that is me fits on this spectrum with these very specific different criterias. And I think what has happened with autism is that people have, I mean, people use it as an insult, which I think is really, really horrible. But people have an idea about autism and they're very fixed about it, and they think, oh, it's a boy who likes maths, and they're very rigid and they're not very friendly. And you have these pre-existing ideas of what autism is, and we're learning all the time. There's plenty of research being done and more light will be thrown on this area, but essentially it's a very complicated thing, and if you've met one autistic person, you've met one autistic person. You've not necessarily met everyone, and gender and your background and your personality has such an effect on how autism shows itself in your life. So thank you very much for joining me on Auti Talk. I hope I've managed to clear up a few points around autism.